This is a 22-year-old male patient whom I saw the previous day. He's a Tourrette's patient with all kinds of facial tics and head movement disorders and vocalizations that he cannot control. This patient makes these facial grimaces and head movements constantly, 24/7. He finds them physically exhausting.
We're going to record you through treatment so that we can keep a record of the progress.
In addition, he sweats profusely. Well, both. We need both of them to do it.
Do you get tired as this happens?
Yeah.
It wears you out, huh?
It wears me out a lot. I'm always tired.
What you see is tongue blades that he puts in his mouth. I have given these to him, and he varies them up and down, and as you notice, it stops his head movements and his vocal tics instantly.
Are you going to take pictures? He gives you a breather, huh? So you can relax a little.
This is the third day since I have seen the patient. We initially took impressions of his jaws, and we have had a lower mouthpiece made over the last 2 days to fit to his mouth today.
Have you been using that temporary thing since you left yesterday? And you can tell you're more relaxed, right?
Yeah, I'm starting to sweat again.
Yeah.
I'll start sweating.
It is a workout.
Yeah, it is.
When I kept it in, it kept smashing down. You know, I can feel a little bit more.
Some of the height, yeah. You were
Well,
losing some of the height.
yeah, it was something else smashed down real quick. But,
I made him an appliance,
but it's not as
and
bad as last
I
time.
am in
Yeah,
the
you said
laboratory adjusting it. You can hear the grinding noise in the background, and that is me working on his appliance. He is being interviewed by my dental assistant.
And the amazing thing is you get to rest,
Yeah,
you know, because it really is a
luckily-
workout. Yeah,
I'm not sweating.
yeah.
It's like you turn on the switch. When it comes out, he starts sweating because he's fighting so hard to try to keep it in.
The previous day, I gave him a bunch of tongue blades and varied the height of them up and down to alter his vertical dimension or the space between his upper and lower jaws. And I dismissed him with a handful of tongue blades, and he has taped them together and holds them in his mouth. Spread your lips just a little bit like that.
Hold on, let me zoom in. Yeah, you can.
Now we're putting in a splint here. The patient is closing down on soft acrylic that the assistant has mixed up and applied to the splint. He will close down until he reaches 11 millimeters on the ruler, which is the height of the tongue blades I previously measured that the patient arrived at by wearing them and adjusting them up and down the previous day and evening. This is the height at which he arrived at which his symptoms were totally gone. So this is going to be our starting point at which I will construct the splint, and from this point I will vary it up and down at future appointments. I have allowed the acrylic to harden up, and I have trimmed the occlusal surface down so it is flat. This is going to be essentially what is called a pivot appliance. It is going to have one-point contact on either side with a lingual cusp of the maxillary first molars occluding with a flat table of the lower appliance. We are going to rebalance the lower appliance so that he occludes simultaneously in time on each side and with simultaneous pressure on each side. Notice how his vocal tics stop instantaneously. And that's all there is for for today's appointment. It's that simple.
It was last seen 12 days ago, and he's back today for an adjustment.
Within 12 days, my life has extremely changed. I've had a couple of job interviews. I've been able to sleep a lot better. All of my tics are pretty much gone. I still have a little noises here and there, but it's not compared to what I had 12 days ago. I just feel totally different about myself. I've had more energy, able to get out in public. I'm able to walk into places and not feel that people are staring at me. It's pretty much a confidence booster for me. It's made me change a lot. Friends and family they can't believe it. So it's definitely done some help to me.
Okay, in 12 days, this patient has worn the appliance down a little bit, and we're just going to resurface it a millimeter or so, maybe even less. And these noises that you hear and any slippage back to his original condition will be totally eliminated. 100% gone?
A little bit, there's still a little bit more. Like I say, I think it's because of the nerve is forming back.
Okay. This is the end of the second appointment, 12 days after the first appointment. As you can see, all the vocal tics are gone. Everything is quieted down. And we're going to send this young man back to his mother and his girlfriends in this condition. This is the patient as he returned 12 days after the insertion of his lower appliance. Notice the absence of his presenting symptoms, the facial tics, the vocal tics, the head movements, etc.
Tell me what the difference has been in those 12 days.
Well, I've had a lot more energy. I'm able to get out places and just be able to enjoy the atmosphere and not have to worry about people, looking at me. And I've been able to go to sit-down restaurants, and it's been amazing treatment for me. It's helped me 100%, and I'm very blessed to have been able to get y'all to build this appliance for me.
I know it sounds easy, but it's really
Good. Now, your symptoms were mainly
the vocals. It was mainly loud vocals, and with a little bit of head jerking and body jerks. It's completely went away. I'm more rested, not having the body jerks, more energy. Don't know what to do in a day's time, so everything's just gone.
And last time Dad was here with you, and did you drive up or did
He did.
he did?
But after I got the appliance, I was able to drive and be able to actually relax and not get stressed out to make my Tourette worse. I think I was about 5 hours of sleep that we had that night when we left, and usually stressful situations it would get worse. But with running through all the traffic, it was around 6 o'clock when we actually got to the highway. It was an 8-hour trip, so I drove the whole way, and there was no signs of it. There was a lot of traffic that night, and I was just calm as could be.
Good. Now, you were telling me something that I never thought about, and that was about reading.
I was the night I got the appliance in, I was actually able to read for about an hour, where I could actually understand what I was reading and not have to start back over numerous of times and just eventually get aggravated with it and just put it down. So I'm able to actually enjoy reading and not just have to hear everything on TVs. And that's a big change, because I never used to read because I didn't enjoy it. There was no way for me to learn anything from it. So.
Okay. And what about your friends? What did they say?
It was hard for friends. Family understood a lot better because they've seen the videos and stuff. But with friends, it was the day after I got back was pretty much a day of demonstration to let everybody know how it worked. And I had a lot of people that was just denying that this was a device that helped so much. But then it was basically a demonstration day. I had to take a whole day and show everybody, so they eventually came to realize that it was there to stay. So.
And how about you had those severe sweats?
Yeah, had a lot of sweating. When I get into quiet places, it makes me nervous, so I try to suppress it a little more. Eventually, it would just make me sweat, and eventually it just make it worse and have to come out anyways.
And
now there's no sweating, got dry clothes, and got to worry about finding a place to dry off.
What's your favorite shot?
So it's helped out a lot too. And with the loud vocals, sometimes I would be hoarse a lot because of yelling out. I had a lot of neck pains, back pains, and they're gone. I'm actually able to sleep for 15 minutes, go to sleep within 15 minutes compared to an hour and a half, or sometimes more. Just depends on how stressful that day was. But now it seems like I could have all the stress in the world and I'll still get to sleep within 15 minutes. So,
it's even better.
Yes, it's amazing.
And your dad was saying he doesn't have to wear hearing aids anymore.
Yeah, I'm actually, with being quieter, his hearings came back, so that saved some money. Have to get some hearing aids before too long if we didn't get this corrected, so it's helped out with that.
And last one, how did Mom do?
At first, Mom was still, didn't want to believe it. It took about a day to her to finally realize that it was gone. At first, I think it was more of a shock to her than just not believing. And it took about a day or so to set in, to realize that it was actually gone.
After 14 years, it only took one
thing to cure it, and it's still, after 12 days, it's still hard to believe that I don't make any sound, or I'm able to get out to go places and not have people staring at me. So it's a blessing.
Good thing. All right.
This is a patient 1 month after delivery of the appliance. He was returned. The appliance had worn down a little bit, and some of his symptoms had started to creep back. But he'll describe in his own words now the improvement he has experienced in the past 30 days. So why don't you tell him what's happened that you've experienced?
Well, in the past 30 days, I've had all of my symptoms gone. I felt my jaw actually shift forward, my lower jaw shift forward, and that's when I noticed the symptoms started coming back a little bit. But I figured I'd have to get it built back up. But now, since I've got it adjusted, I don't have any feeling whatsoever.
And you've been offered a job in law enforcement?
Yes, I've been offered a job. I got to go Wednesday for a training for a law enforcement job, and hopefully that'll go well. I've never really got to experience any kind of job working with the public, so it'll be a lot different.
Okay. Tell us about people that knew you before, you know, the experience other people, friends, neighbors, etc. have had.
All my friends now have pretty much gotten used to not hearing me. Sometimes it'll be a little awkward for them because they're so used to it. But other than that, I've still got people that I haven't talked to in a while that will call me up. I had actually a phone call last night where a guy called me and was wanting to know how it was going because he heard about it.
Okay, well that's good. Okay, give me some blue. What I am going to do now is adjust the appliance 3 or 4 times using articulating paper to make sure it strikes equally on both the left and the right sides with simultaneously in time and with pressure. Notice, however, when I remove the appliance from the patient's mouth, the symptoms do not return as they did when I adjusted it on the delivery appointment. The symptoms, the vocal tics, the head movements are gone, and they stay gone while the appliance is out of the mouth. This symptom-free interval increased while the patient was wearing it and as his nervous system adapted to the appliance. Does that feel even now?
Yeah.
That's the total adjustment we're going to do. It doesn't get any quicker or easier than this. This is the initial appointment of a patient who comes to me with gait problems, meaning walking disabilities, and all the typical symptoms of a Tourrette's patient. She also has the symptoms of a TMJ patient. You can see in this video she is using a cane. She also described to me that she uses a walker also when her condition worsens. You can see the MRIs of her on the view box in the background. We never, ever initiate treatment without MRIs on these patients. This is the very next day. What we wish to accomplish on this is a diagnostic workup, which means a bunch of very sophisticated tomographic x-rays through the temporomandibular joints, impressions, and possibly her splint delivery. She comes with all kinds of head movements, hand movements, foot movements, and pain. Notice the uncontrolled movements of her hands, feet, and head.
She's holding her head up. That's what he's saying.
Okay.
Tell us what your symptoms are so we can record them.
I feel really, really tense all through here, and I can't stop twitching, and my eyes blink like crazy. And it shakes, like the back of my skull almost, like shakes.
And how long has this been going on?
All the time.
Years?
Yeah, well, I didn't shake like this. I just didn't have until I started screwing around with my mouth TMJ stuff, but I didn't have any motion in my neck, and I would get horrible neck pain and stuckness, like torticollis thing, and migraines. And now those are getting better, but I twitch a lot. If I'm not somehow supported, so I like put pillows under my arms and under my head and stuff, but raising my mouth seems to help stop twitching. I still get twitching sometimes, but not like this bad when I have something in my mouth. And opening it wide hurts.
Constant eye blinking and head twitching are cardinal signs of Tourrette's syndrome. Pain upon opening or limited opening of the mouth are cardinal signs of internal derangement of the temporomandibular joint. Many times these patients will present with symptoms of both Tourette's and TMJ internal derangement. I have had the patient using tongue blades in her mouth to determine what the vertical dimension is so that I know at what vertical dimension to construct the lower splint. At this point in time, I am delivering the lower splint for the first time. Okay. Well, let's see.
Yeah, there's one like there's a high back right over here, but otherwise it should be much better, like the left and the right side seem.
You like that, huh?
Yeah. Sorry. In here sometimes looks like it gets a little like.
As I take the appliance in and out of her mouth, adjusting it each time, notice that when I insert the appliance, her head and facial movements and blinking greatly diminish. And then when I take it out for the adjustment, they return. And then when I put it back in the next time, they greatly diminish. You breathing better? Okay. Let's see you get up and walk. You think you walk?
Okay. But I wasn't walking as much normal when I came in, you know.
Yeah, I didn't see it come in, but were you walking when you came in?
She was walking a little bit funny. Like this.
Okay, turn around and is that any better at all than when you came in or not?
I think it's a little bit better. I still feel it here, but I'm not. Well, it hurts just as much. I'm not quite as wobbly, I don't think.
Okay. Walk back over there. Many of these patients also suffer from low back or sacroiliac pain. This is due to sustained muscle contraction in this area. The patients invariably experience relief of these pains due to these appliances we make. We judge the effectiveness of the appliances by how they walk initially. Any improvement of the walk occurs in the first 2 or 3 minutes and then continues thereafter. And it gives us an idea of whether we're on the right track in the treatment of these patients. Believe it or not, this is an improvement in her walking. If you did not discern any noticeable difference, notice how her walking completely degenerates when I take the appliance out of her mouth. Not as good, is it?
I feel shakier.
Okay, I'm going to add to this. I have increased the vertical dimension 3 times, in fact, on this patient. You seem to get out of the chair a lot easier. Okay, turn around. Okay, let's leave it like this for today, and this should improve. Practice walking backwards at home, not particularly here. Do that like 5 or 10 or 20 times a day, 10 feet across your living room or something. And people seem to adapt to it, improve quicker with practicing walking backwards.
Okay.
And
Okay, this is the next day. Go ahead and tell us how you're feeling.
I'm feeling really well. Yesterday I went home and just napped for a little bit, and when I got up I could walk much better, more steady, and my low back pain was mostly gone. And I could do a little bit, like just leaning that little bit forward and back that normally kinks me up. I could do that, which was really good. And this morning I'm walking really well and sturdy, and my neck has calmed down. So, and I can actually like look up and down, which normally, makes me twitch a lot. So.
And no spasming.
No, if I take this out, it will spasm, but this is pretty good for me to be able to lift my head up that far.
Okay.
And I don't have any, I'm walking pretty evenly.
Okay,
So really good.
good. Let's see. So your hands aren't shaking anymore.
Nope.
Let's see.
Nope. I can hold my head up by itself.
Okay, go ahead.
keep in mind that these results were obtained within 24 hours of her initial appointment without the use of medications or psychological therapy to suppress her symptoms. We are trying to treat the prime cause of her symptoms, which will be revealed to you as we go through this DVD. Okay. Her opening has increased to 46 millimeters. Yesterday it was 41 millimeters. That's a 10% improvement, just like that. We're going to do a final adjustment and then send this young lady back to Cleveland. Jumps out. Okay. This is the final splint configuration. Okay.
Wonderful.
6 or 8 weeks, will you?
Yep, we got 6 weeks planned.
Okay.
Already in the book.
Good.
Thanks, you guys.
Bye.
Remember her initial appointment when you saw the MRIs hanging on the view box? These are MRIs through the left and right temporomandibular joints in both the closed and the open positions. The big question is, what did they reveal? Because you recall I told you that most of these patients were both Tourrette's and internally deranged TM joint patients. And although we have addressed the Tourrette's symptoms, it is not sufficient, in my mind, to do just symptomatic treatment. You have to address the prime cause of all the symptoms. It is now time to address the TMJ symptomology. The MRIs revealed that the discs within each joint were anteriorly dislocated without reduction. That means they were displaced to the front and did not go back into place upon opening of the mouth. This is why it hurt her to open and why her interincisal opening was limited. Although you may think 46 millimeters was a normal opening, to me, it is an impairment of function. The normal opening should be 50 to 54 millimeters, in spite of what you may have been told by other people. So therefore, we now address the internal derangement, and we do this by open joint plication surgery. It has been my experience over the past 45 years that if you address only the symptoms without the TMJ dislocation, the treatment will have no stability and the symptoms will return within 1 to 3 months. Therefore, to provide long-term stability in the treatment of these cases, we must get the left and right displaced TMJ discs into their normal anatomical position in such a way that they stay there. And we do this through left and right open joint TMJ plication surgery. Those of you who are healthcare providers should know that it takes a very courageous patient to proceed with this step of TM joint surgery, because they have experienced such an improvement in their symptoms that they are afraid that they will risk losing this improvement if they go on to this additional treatment. To me, this is an irrational fear. It will only improve them if the surgery is done correctly. This is the patient 3 days post-surgically. She had a left and right open joint plication procedure. I've reviewed with the patient what her presenting symptomology was, and she's going to tell you the improvement.
I feel great. I'm surprised at how great I feel I can move without tremoring, and my back and my neck are not hurting. I can do the opening of my mouth without tremoring. When Dr. Stack was just measuring me and taking my appliance in and out, my head wasn't shaking, my arms weren't quivering, and I'm not in pain. I've been in pain for a very long time, so I don't even know how to explain it. It's really wonderful. Do you want specific?
You had trouble walking, right?
I had a lot of trouble walking.
Okay, why don't you get up and walk out there and then back, and we'll just...
I can get up and down without using a cane or a walker, and I can walk
Okay, see that?
with a regular stride. I don't feel like my thighs are pulling on my back anymore, and I feel like and my neck isn't sore just like all the time. Usually it's hard for me to just hold my head up.
Okay, do it one more time up to that. Way at the back.
What's the difference likely to be when she's off the medication?
Even better. Even better.
Getting really much better. Except my chair's moving.
Okay.
Yeah.
Okay, we are rebalancing the patient's surgical splint to compensate for any spasm, muscle spasm, swelling, etc. And then we'll dismiss the patient and see her in the near future.
Since right after surgery, I have been just amazingly better. For the last 10 years, I've had constant pain in my back, in my neck. I've had debilitating migraines. I have walked bent over funny. I tremored. My tremors got so bad that I couldn't stand right. I was using a cane. Sometimes I've been sleeping on and using a massage table. I haven't sat on a couch in like 10 years. I have been through every physical therapy, back surgery, steroid shots, pain blocks, everything, and nothing has worked. And the surgery, since I woke up from surgery, I could stand up, right up. I always used to have to push myself up with my arms, and I would be shaking. I couldn't look up in the air or to the side with my head, and I would blink like crazy, and my head would twitch to the left, and my husband would have to carry me around and get me up and down the stairs, or I couldn't go. I was homebound a lot, I couldn't drive a lot. I had trouble attending things, like just having trouble, you know, going to my family's weddings and things. So I was very non-functional. And since the surgery, I can walk. It's not pulling on my back. I don't have constant back pain. I don't have constant neck pain. I stride normally. I have had no tremors at all. None in my hands, none when I'm moving, so I can move up all the way, and that would normally make my whole body tremor. And I can look to the side, and I can stand and sit without having any trouble with my back, without using my arms to hoist me. And I'm walking upright, so I'm going to be able to get stronger because a lot of my muscles didn't work the right way for so many years of compensating. So now I'm just working on strengthening and getting the proper muscles to work. But it's truly amazing. My family, my doctors can't believe it. They're so excited, and I feel happy. And they say I'm like I used to be. My face and my movement, and it's just so nice not to have constant pain all the time and feel like I can't even get around my own house. So I don't need a walker. I've used a wheelchair, and I haven't used that or my cane or anything since surgery. And if anything to add, he hasn't had to carry me anywhere. So it's been wonderful. I'm really just excited to keep getting better.
Would I call my local hospital first?
Yeah.
Would that be a place to start?
Hey!
Yeah,
How old are you?
14.
This is a 14-year-old patient that presented to us with Tourette's.
Hey!
Okay. So what are the tics that you experience?
I have a lot of neck twitches, as you can see. I usually just have to crack my neck. I have to keep flipping the hair out of my face because it touches my eyes and that just bugs me. Hey! I yell a lot. I have a few verbal tics. I have to say things. I haven't been doing those lately though. I've been really doing the necks twitches a lot lately. So.
Do you want to say
Keep doing. Keep explaining to the audience.
I have some kicking and hitting tics. I don't actually hit people, but I have to hit walls and stuff, mostly to give off pressure. I bump into stuff a lot. Sometimes I have to bang my knuckle off of something until it hurts. If it doesn't hurt, then I have to keep doing it. Lately I've been doing I have to flex my bones and my muscles and stuff. Sometimes I have to like squint and make faces. Usually when I look in the mirror, I have to. Just because I have to see myself do it. I have to do it in a certain way. Otherwise I have to keep doing it. It has to be perfect, or I have to keep doing it. It also really has to do with OCD, my Tourette's. That's pretty much why I have to get it perfect. So. Hey! Usually when I'm nervous and stuff, or if I have more attention, I do more tics. So. It doesn't matter if it's good attention or bad attention, so. I do have a lot of fun with Tourette's sometimes. With friends, we just joke about it and stuff. It's fun being in an environment where kids can accept you for who you are. I was lucky to be in an environment like that.
All the world's not that easy, right? You get cussed out a lot and looked at.
Yeah. I love acting and stuff, but I went to this theater in Spring Grove, and this girl actually came out and cussed me out because she was upset that I was ticking during the play. But I just explained to her I had Tourette's, and I went on with it. I try not to let that sort of thing bother me, so that I can just live on with my life happily. It's not good to focus on that sort of thing. I did have depression from Tourette's around 2007 because I used to let it hit me hard, so just stopped focusing on that. So.
We're going to do the best we can for this young boy. Fortunately, he's understands his problem because he has a IQ of 128. These patients are not low IQ children. They're very, very smart, trapped in this disease, and this is what the dental profession should be doing to help these children out all the time. This young man is getting his lower appliance today. We just put it in a few moments ago. And you can see it has caused a diminution of his facial tics and his vocal tics and so on, although they're still not completely gone. They will go away over the next couple of days. You can see that it's barely noticeable in his mouth. Actually, this is a repositioning TMJ appliance because he has bilateral reducing disc displacements in his jaw. I believe underlying all these Tourette's patients, at least every single one that I've ever seen, they all have an underlying internally deranged temporomandibular joint, which has been totally missed by the Tourette's community because they've misdiagnosed all these cases because they have not evaluated them from a TMJ perspective, nor have they taken TMJ imaging studies, particularly MRIs. Open. This is what it looks like. You can see that it's got highly indexed occlusal spaces for his upper occlusion. It's got these ailerons on it to elevate his tongue. That opens up his throat. One of the first things the patient notices is that their breathing increases. Tests show their oxygenation and the oxygen level of their blood rises when they wear this in because their throat opens, their epiglottis moves forward, their tongue position changes, etc. And this just gets placed on his lower back teeth and is held in place by these clips, and the patient just puts it in and it clips on his teeth, and then he just bites into it, open wide. The best thing to do is initially open wide and then close down into it, bite like that, and that's all there is to it. And that sets his jaw in the correct maxillomandibular relationship to the base of his skull, decompressing the tissues of his temporomandibular joints at the skull base. Say Monday, Tuesday, Wednesday, something in that order, if you can make it back. Okay? Once it's been in, can you make any or discern any differences in your breathing? That's usually the first thing, the breathing, the decrease in any urges to tick or just speak to the audience.
Well, I have this foot tick where I have to crack my ankle all the time, like every time I walk, every time I sit, and since I've had this bracelet, I haven't done it nearly more than twice, and that's really awesome. I have barely done my neck twitches, and they've been hurting a lot lately because I've been doing them so much. But with the breathing, I actually thought my breathing was normal like everyone else, but when this thing was put into me, I just felt like clear, like I was breathing air for the first time, and I just felt so good in my throat, like it wasn't clogged or anything. It just feels open. It's really awesome.
Okay, good. This is the patient as he returns 6 days later. He's been wearing this about half time during the past 6 days because his time has been preoccupied with a school play in which he has been participating in it. But now he's promises me he is going to be wearing it 24/7 for the following 2 weeks. What I've done is in the past 3 or 4 minutes rebalanced the occlusion so he's hitting evenly on both sides, and his jaw is repositioned so his lower jaw is advanced and his incisors meet edge to edge. Wait. Zero in on this. This is his occlusion right now. Open wide. This is the appliance in his mouth, and it's highly indexed. Bite. Now see, and he goes right into the indexing, and this moves the mandible forward, taking the pressure off his temporomandibular joints and reducing the recurrent dislocations. So just look into the camera and let them see your face. Do you want to mention any benefits or non-benefits you've received over the past 6 days?
Well, actually, I got a lot of benefits. Right away, I actually I stopped doing ticks a lot, and lately I haven't done them at all. But I did take my brace off one time, and I actually had a tick explosion where I was going nuts. I think that happened because I took the brace off. So that was the downfall part. But I think this brace really works.
You had 58 ticks originally. Didn't we just establish that at your initial appointment?
Yeah.
Okay. Let us see you in 3 weeks, and I really want you to wear it faithfully. Okay.
Okay.
Good. This is my buddy Jesse. We gave him this lower appliance. Let's see, a month ago, and he wore it for a couple of weeks, and then he lost it, and he came back, and we took an impression a few days ago, and so he's been without the appliance for how long would you say now? A week or 10 days?
Yeah.
Something like that. Okay, and then we're going to deliver him a second appliance in a few minutes, and so we just want him to tell the audience what happened while he had the appliance and what happened after he lost it and how he feels now. So look at the camera and tell the audience how you were doing before and after you lost it.
Well, when I had the appliance, I was really calm and I didn't do ticks nearly as much. In fact, I kind of forgot I had Tourette's more than I usually do. With school and stuff, I just was barely ever doing it. I took the appliance off for about 4 days, and I actually had a tick explosion, and where I was going nuts with Tourette's, and then I put it back in like the next day, and I was all calm again. So it was like, and nothing happened. I feel really good with it, and it's just like like I said, I don't notice I have Tourette's when I have it, not as much. When I lost it, I was really bummed because I lost it, because it was like really my only way to get out of it, and I kind of felt like I was more hyper, like afterwards, and that I sort of kept getting off track. I couldn't stay focused anymore in school, and actually I did really bad on my last 2 tests, and I'm not turning in homework, and because I can't stay focused. But when I had my brace, I could always stay focused.
I am letting the camera run so that the viewer can observe these ticks that have returned, particularly his foot ticks and his head and neck ticks, as well as his vocal ticks. Had he worn the appliance for 2 or 3 months steadily, these tics would have not returned. For the professional viewer, please keep in mind that I have only seen one patient that did not have an underlying internal derangement of the temporomandibular joint as a cause of these tics. Please keep in mind that there are 3 types of internal derangements, not 2, that occur in the temporomandibular joints. In addition to the click and the locked joints, there are ones in which the disc is in proper relationship to the condyle, but both the disc and the condyle complex are in malrelationship to the posterior slope of the eminence. That was the one exception that I have encountered over the years in treating these patients. The reason you are seeing more boys than girls with this affliction is that studies show that Tourette's is 5 to 6 times more common in young males than it is in young females. And it usually begins at 7 to 8 years of age and increases as these children go into the teenage years. Some of them outgrow it, but a lot of them do not outgrow it. We have treated these patients in their 30s and 40s, but the bulk of them are in their teenage years, from 14 to maybe 22 or 24 years of age.
Yeah, I know.
Okay, your thing's is hardening up. It's modified.
It's starting to get kind of hot in here.
Huh?
Is it hot in here, or?
Not particularly, but he's probably is. Okay, I'll be, as soon as it gets hard, I'll bring it right in.
Alright. I'm starting to get real tired. I'm starting to sweat. Wow, dude, why am I doing this?
I have just inserted the appliance and am inserting articulating paper to adjust the bite. You will notice that he identifies the right side of the appliance as being too high several times. I then lower the right side. It must be balanced. The appliance must be balanced so he hits both sides when he occludes simultaneously in time and with pressure. One side cannot be higher than the other. He identifies the right side as being too high 2 or 3 times. You will notice that once the appliance has been balanced perfectly, his symptoms immediately cease. Okay, the appliance has just been delivered now, and it's been sitting in the patient's mouth for approximately 5 minutes. And you can see how his activities have more or less decreased greatly. And as he wears this, they will decrease and stay decreased for longer and longer intervals. There might be a few instances where they break through to the surface, but those instances will be fewer and fewer. In the 5 minutes time that the patient has been sitting here, he and I have had a heart-to-heart talk about wearing this full time. And he must wear it constantly when he eats, kisses all the pretty girls in high school, talks and gives reports in class, etc. He has to function with it 24/7, or else it won't do him any good, and he will only be a partially treated Tourette's patient. And that's not good enough for me or for him. You have anything you want to say to the audience? Like you're on TV?
I'm gonna take better care of it, and I'm gonna wear it all the time, starting now.
Okay, good.
And I just do want to say, I really do feel different right now, and it really does make a big difference.
This is Jesse as he returns 6 weeks later, and what we've done is convert his intraoral orthotic from a pivot appliance to a repositioning appliance, where we have lowered the height of his appliance and indexed it so he is now biting with his mandible in a forward position here. This further decompresses the tissues of his temporomandibular joint. Okay, pan him. You can see him here. Look in the camera here, and say something to the viewing audience here. How you've been doing in the last 6 weeks? You've been in a school play.
I've been in a school play and a band concert.
Okay, don't look at me. Look at that.
Oh, sorry.
Okay.
And I've actually gotten to the point where it's working so well, I kind of forget it's in my mouth, and it's just there. It's already it's part of a normal day routine with it now. And a lot of my tics, I've noticed, have kind of drifted away to the point where they mostly never come up. I haven't gotten mad at all since I've gotten this piece in, to the point where I've yelled at someone. I haven't yelled at anybody in a long time now. I haven't been emotionally overbearing at all in any state. And I have a clear mind every time I have it in, that I can think about my work and get it done. And my grade's been going up. So.
I'd like to introduce you to Jesse's father here, who has accompanied him, and to say a few words. Come on in here.
Yeah, Jesse's teachers have reported back to us that his tics are significantly less during class time. His focus is better, and we've definitely felt around the house that Jesse's ticking less and that he's more peaceful. There's some kind of emotional connection here too, where just not ticking so much has helped him to relax in a lot of areas. But he was yelling certain words 2 to 3 times a minute, and now we can go an hour and not hear it at all.
Okay, this is Justin, who has come into our office, and as you can see that he's a Tourette's patient, and we're going to begin his treatment today with fitting him with a lower mouthpiece to stop all these uncontrollable motions that he has. And we're going to videotape these motions for a minute or two, just so the viewing audience can appreciate what he has to go through. Justin is a 17-year-old young man who began suffering from these things at the age of 8 years of age, and it's about time that he got rid of them, and this is what we're going to do for him today. How you doing, Mr. You don't believe you that? I'll give you that. I'll give you $50,000 for that head of hair. We'll just take it right off. Okay, I've just finished working on the appliance, and we're going to put it in for the very first time right now on this young gentleman. Did that hurt you?
No, it's checking.
Yeah, like, how's that feel now?
Weird.
Does it feel even? Or does one side feel a little higher than the other?
Feels pretty even.
I am inserting the lower mouthpiece at what I think is the correct vertical height. This is the most critical element in the delivery process. As you will see, this is not the correct vertical for this patient because we subsequently modified it by adding to this height the thickness of 1, then 2, and then 3 wooden tongue blades. And with each addition, the patient reported that his symptoms and urges improved. We then added additional acrylic to take into account this additional height of these 3 tongue blades to the original height of the appliance. And you will see the response of the patient to this height. Chop, chop. Ticks are supposed to go away when I put that in.
Really.
Tell me what's happening to you.
Well, what?
Does the urges seem less?
I guess. It's not really, I don't really shut my mouth. It's
Yeah, I don't want you to shut your mouth.
like close my jaw. Pretty good. I mean, it's not.
How wide did you open him up?
Oh. It's easy to open. Wait. From there. Take a look. See, this is a finished orthodontic case, if you can believe that.
Yeah.
Open. There, bite.
It's about a centimeter.
Well, yeah, about 6 millimeters. 5 or 6 millimeters. So 100% deep bite. 100% incisal guy and garbage.
Now, are we just seeing if my chicks come?
That's what?
If my chicks are coming down. Is that what we're doing here?
Yeah, just see if it's calming them down more.
It is.
With this in there?
Yeah. It's just a little bit.
Does that help you? The tongue blade help you? Seem to be helping you?
You put that's a lot better. Right there. Two of them. Or two more.
Okay. Try 3. Tell me if 3 is better than 2.
Yeah. Two and 3. I mean, they're both
Okay.
the same.
Take it out. Mix me up some stuff. I've added some additional acrylic here.
Thank you.
The amount being the thickness of those 3 additional tongue blades. Now I'm going to let the acrylic harden and trim it to the thickness of those 3 tongue blades. Okay.
It's on.
Okay, whatever. Can you tell that's higher?
Yeah.
How's that feel?
A lot better. It's a big difference.
It quiets you right down, doesn't it?
Yeah. Just a little bit. My tics are just like way much more calmed down.
Yeah. I'll let you sit here for. I'll let you sit here for a few minutes. Okay.
Okay. Yeah.
Okay. Just keep filming it.
Oh.
I can't hold this that long. Do you want to help one in? Thank you. My arms get tired.
You got a weak arm.
They get numb
No.
from this one.
Oh.
hand into my nurse.
Let's give him a new appliance. He had broken the clasps off his original appliance, which decreased his stability. His symptoms did not return. He has been wearing an appliance for a total of 5 months. And we are showing you this video footage to show that his corrections and improvements are long-lasting. He will tell you that his symptoms started to diminish within a week of the original appliance's insertion, and they have been gone for the last 5 months and stayed gone. In his history, he also had 5 years of constant everyday occipital headaches, which are headaches in the back of his head, every single day for 5 years prior to coming to see me, and he hasn't had any of those at all since the insertion of this appliance. He's going to say something to the viewing audience, and now just tell them what you how you're coming along.
I am doing fantastic since I've got this appliance in. It has, my tics have completely diminished. Even after I have my appliance out, my tics are still not there for hours and hours after I have my appliance in. I haven't really tried to go days, but I've had them out for a couple hours.
He's had a total of, he estimates, of 20 tics.
Yes.
He got this appliance over the summer, and the children in his previous grade school knew about his tics, so he went and registered in a brand new high school, and they are totally unaware that he is a Tourette's patient. He's got them all fooled.
Yep.
And he started to make relationships with girls now, got them fooled too?
Trying to.
Good for you. Anyway, he's going to continue wearing this, and it's very, in my opinion, it's very easy to treat these Tourette's patients, at least teenage boys and girls. They're much more easy to treat or respond a lot quicker than Tourette's patients in their 40s and 50s. Those are the ones that seems to be more resistant to treatment and takes longer to treatment and takes greater skills to treat. It's much easier to treat these youngsters.
Justin is doing so much better. He hardly notices, his tics, and he started at a new school, and they haven't even noticed that he has Tourette's. And when we first went in to talk to him, we told him how bad it was, and they can't believe it, because he doesn't tic at all, hardly. I mean, it's an amazing difference.
Have you brought home a young girlfriend yet?
Not yet, but we're working on it.
Oh, okay. Well, that'll probably be the next step. Okay. This is a young Tourette's patient with OCD whose tics began at 9 years old. He gives a history of head bumping, lip licking, vocal tics, throat clearing, shoulder muscles twitching, a feeling like he wants to explode, snorting, back arching, etc. What's your worst tic that you have?
My worst tic is probably right now it's probably maybe the lip licking. Yeah, lip licking tic. What it would make me do is make me move my lip up and rub the all the saliva on it, and then it gets dry. And I'm gonna get it. It could last about maybe about a week, depending how much it.
Show us how you do it. And you do that all the time? Or most of the time?
Mostly, once in a while, it does it.
And you have a head bobbing tic?
Yeah, the head bobbing tic makes me, during the 4th grade, I didn't know that I had Tourette's when I had my, friend over. We were in the backyard. I was by the fort, and I kept bobbing my head, and I was like, I kept bobbing my head like this, and it eventually started to kind of hurt a little. And I was like, he asked me, "What's wrong? What's wrong?" And I said, I don't know. I didn't know, and then eventually we found out that I had Tourette syndrome.
Okay. What other tics do you have?
Sometimes I have a certain kind of tic that, like if I'm walking through, like maybe the mall or a grocery store, kind of wants me to like go like this and bob back.
Oh, okay. Do you have any shoulder shrugging tics or any other walking tics? Or?
I used to have a tic that would have me twirl around in circles in Target.
Oh, Target store.
Yeah, it would have me. It was during the 5th grade.
Okay.
That would make me like just twirl around.
Twirl around. Okay. Okay. Well, today we took all kinds of impressions and X-rays on you to do our fabrication of your mouthpiece, which we're going to have ready for you in 2 days. We'll send it out to the laboratory tonight, and it'll be made tomorrow, and then we'll have it back the next day for you. Okay? Do you have any questions you want to ask?
No, not right now.
Okay, good. Okay. Tell the viewing audience what your hopes are for this treatment.
I hope that this treatment can help me. What I really want to do is go on classes with my friends. I hope this treatment will decrease the level of my tics. I hope that it will really put my tics down, and that I could learn a little bit more better, because the tics, they can really get in the way of your learning skills. So I wish I could so I hope that I could learn better, go around in public more, like I won't do much as tics as a lot. And I hope that this mouthpiece would succeed, and that I would be just like a normal person.
How are your grades in school?
My grades are good, really good.
Okay. Do you have to work extra hard to get good grades?
Yeah.
Yeah.
A little bit, yeah.
Is reading hard for you?
Yeah, reading can be hard.
Yeah. Okay.
It's hard for me.
Okay. Let's leave it there, and we'll see you again when we put the appliance in for you.
Yeah.
One of the clinical signs that this patient was overclosed, or that his lower jaw was too close to his upper jaw, came on the lateral skull x-ray, which you see here. When the teeth are closed, the lower lip is supposed to be vertical, and as you can see on this patient's x-ray, his lower lip is horizontal. You can see this vast curve underneath the lower lip here. This should not be here. Whenever you see a patient's soft tissue appearing thusly on an x-ray, you can know that the patient is overclosed. Another way of saying this is that his chin is too close to his nose, and this dimension needs to be increased, which is one of the functions of the appliance which he will wear. Another clinical indication is that his overbite, or the amount of vertical overlap of his upper teeth overlapping vertically the lower teeth, is too great. It's 60%, which you will see later on in a frontal view of his teeth. It should be no more than 20% at the maximum. These are both indicators that he is overclosed and needs to have the distance between his upper nose, lower jaws increased. This young man's intraoral mouthpiece today. The question always arises, how thick do we make it, how tall do we make it, how high do we make it? And one way to do it is by putting in popsicle sticks or tongue blades and varying the height up and down to see what makes the tics go away. We have done this on him and have determined that a height of 3 tongue blades drastically stops his tics. And so we are going to start with a height of 3 tongue blades initially for his mouthpiece. What we are going to do is mix up some acrylic, put it on this mouthpiece, and then have him close down on the soft acrylic till he reaches a height of 3 tongue blades. Open. You ready? I am loading the freshly mixed acrylic onto the mouthpiece, like so, and I'm going to put it in the patient's mouth. Open. Making sure the appliance is completely seated on his lower teeth. And then I'm going to have him close down, bite, until he closes down on the 3 tongue blades. Then open. I'm going to have him open. And I'm going to take out the appliance. And then I'm going to put it in the cooker while it hardens up, and I'm going to trim off all the excess acrylic. Okay, we have adjusted the patient's appliance, open, and we are delivering it right now. And fitting it to his bottom teeth. Bite. Okay. Okay, now how's that feel? Yeah, hitting even? Yeah, okay. Good. Okay, look in the camera. Look in the camera. Okay. Now you're coming back this afternoon, right?
Correct.
Yeah. At what time?
I think like 1:45.
Oh, okay, good. That'll give him about 3 hours with it, then we'll do the final adjustment. Then you'll leave it.
Take care.
Yeah.
Okay.
I'm just worried about, following the day, just getting adjustments is what I have to make sure I get a hold of the TMJ specialist and get us to maybe talk to us about.
Yeah, usually we would normally see if you lived around here like in 6 weeks, but you can see someone out there that's 4 to 6 weeks maybe. You feel more relaxed or anything like that? Yeah, good. Okay.
You could notice a difference.
Say again?
You could notice a difference.
Turn it up.
Mouthpiece has really helped. Really helped with this. It has really improved that I'm not as ticking as much. Like I would still have a few ticks once in a while, but over time it will get better. And during the 3 hours, I was like hardly ticking, and it really helped. It really helped. It really did. I'm talking fine with it, eating fine with it. It's not hard at all. it's really easy to eat and talk with it.
Ken has had the mouthpiece for 3 hours now, and he's just come back here before he leaves town, and for a quick checkup, and he seems to be progressing quite well. This is a torticollis patient that presents today for treatment. You can see how she has a left head tilt and the face is twisted to the opposite side. I have come to the conclusion that these patients all have an internal derangement, and we have had this patient get an MRI which has documented this. She also has severe condylar osteoarthritic degeneration of the right TMJ condyle, as documented by this MRI. This, of course, results in the mandible being malaligned to the cranial base, causing a decreased vertical dimension. You can see that she has at least a 50 or 60% overbite here, so she has a decreased vertical dimension. The majority of these patients will have a decreased vertical dimension, which results in compression of the temporomandibular joints and their contents, particularly the fibers of the auriculotemporal nerve, which feed into the trigeminal nerve. Consequently, we wish to decompress the contents of the temporomandibular nerve, and we do this by trial and error with these various tongue blades. Now we're going to have this patient close her eyes, and we are going to insert these tongue blades in her mouth, and we're just going to start with 5 tongue blades. Okay, just close your eyes and open your mouth and put these in, and we're going to have her sit here for a while and just watch what response we receive. You can see from this test that the cervical muscles start to release and the patient's head starts to turn slowly but perceptibly to her left. The longer we let her sit here like this, the more it will turn to the left. This indicates to me that this patient needs more support on the right side of her mouth. She is also missing teeth, molar teeth, on the right side of her mouth. So we are going to build her a mouthpiece that will replace these missing teeth, plus give her additional support to suspend her mandible away from her cranial base and essentially replicate the function that these tongue blades are providing temporarily. I'm just going to increase